So we're doing a workshop today with a company called Tend VR, who are demonstrating a VR headset that can be used as a therapeutic tool in a way to help people do mindfulness when they're under mental distress or they've got hard to treat depression. It's very important that patients are involved in these stages, because not only does it embed the patient's voice in the design or the way the technology is used, but it also allows us to test it and give constructive feedback on what works really well and what doesn't work really well.
Really important for us for our product development, because we need to learn really what isn't going to work for the clinical population that we're trying to build this tech for, because we've had so many great ideas, things we would never have thought of already, and also some really useful feedback on things that we shouldn't do. Really enthusiastic and giving it a go, actually. So they've tried the mindfulness headsets themselves, and now we're working on how we can improve our app that goes with it. And really pleased to be working with M-RIC on this, particularly as we would try and focus the product in a specific clinical population, which is actually an area of unmet need with difficult to treat depression, where people actually really struggle to engage with health interventions generally, but particularly with digital health.
What I allowed us to do is just to experiment a little bit about the reality itself. You could walk around using the VR headset, perfectly safe, didn't get sick or anything because it's a sit-down virtual headset, nothing like some of the games headsets that are out there and the programs there. But it allowed us to go into a couple of rooms and experiment with how to sit down, go outside as well, navigate around and actually pick up some food and some fish. But what it did for me is it gave me a break from the reality, so the busyness of work and life and everything, and then move into a controlled setup where you can have your own space. There's some guided meditation in there as well, some very useful breathing techniques towards the end.
So one thing that really struck me when I came to M-RIC was how involved service user and carers and patients are in the design of clinical services, but also in the design of research studies. One thing we wanted to support and to offer as a service to the commercial sector, the industry sector, is a route to accessing that in a more robust way. So dedicated service user and care representative, or PPIE service, that commercial companies can use to build their product, to design their product, or to design their research methodologies. It's something that we know there's a direct drive towards from funding bodies, and something that's going to be needed going forward for medical device regulation and for acquiring that funding and engaging in that research.
Authentic, realistic reality check in that only patients and public can give.